All right, good afternoon. We'll go ahead and kind of get started as I think a majority of people are able to log on. My name's Nicole Hirsch. I'm with the Department of Health and Human Services, Children and Family Services, and I am kind of co-leading the Child, Adolescent, Youth, and Young Adults group. So I just want to welcome everybody this afternoon. Appreciate you guys taking your time out of your day to kind of share ideas with us. If you could go ahead and put your name in the chat, maybe who you're with as usual. I have the privilege to co-host or co-lead this group with 5 other amazing, passionate individuals that I will introduce here in just a little bit. But first, I just kind of wanted to focus our minds to get ready for this meeting on kind of the 4 key reasons why we're bringing all of us together. And that would be to kind of refresh our collaborative knowledge, build connections with other community partners, learn about resources that align to shared measurement. And lastly, probably the most exciting part of this group is to really move toward community action. We've had lots of discussion about gaps and things we want to see in our community and bringing everybody kind of together. But this group is really going to hopefully move forward with taking some action within what we see we need in our community. So with that in mind, I want to introduce our other co-leaders, Chandra Diaz with Ymca. She has a focus on adolescents. Alexandra Dillon with ESU 10, focusing on early childhood. Dulcie Valdez with ESU 9. She has a focus on child-aged youth. Jason Owens. Jason is kind of new to our leadership group, so we appreciate him joining us. He's with the Hanny Arram Center for Success with a focus on adolescents. Chief Brian Waugh with the Police Department, City of Kearney, focusing on all children, adolescents, and youth. And he's really sharing his vision for youth, children, adolescents in Buffalo County on behalf of law enforcement. But for now, I just kind of want to hand this off to Alexandra. She's going to talk about kind of how we got where we are today.
Hi, I'm Alexandra Dillon, as was mentioned, with Education Service Unit 10, Early Learning Connection. And I appreciate the time to be here with you. And I appreciate so much that you're all here. And I think that we'll get started with a visual that Michelle is going to put on for us. We thought it would be helpful as we start our meeting to have a sense of a context of how we got here. And so what you see here is a timeline. And at the very top, there are collaboratives and coalitions that you probably recognize and have been a part of. And we thank you for the tremendous work that you have done and that you continue to do as part of those collaboratives. We get started in the winter of 2020 with our story, and that was when a decision was made by the board to use a collective impact model to help drive the work. And what I find interesting about this model, and it will drive the work that we do as a committee, is that it moves beyond interest into identifying shared goals and measures among the group. And it moves beyond the parties that we may see typically at our meetings and encourages us to ask the question, who's not at the table, that needs to be at the table, who can enrich the ideas and the conversation and the problem solving that we're working on. And it moves and emphasizes a coordination among the parties at the table of activities, and then an emphasis on shared learning and lessons learned. So this is an important model that we will use throughout our work. That led into the identification of wellness indicators that the steering committee identified that would be important areas of focus. And then another model was embraced in the spring of 2020, results-based accountability model. And this model is important to us because it asks the question and encourages us to constantly ask the question, how has an individual or group's life changed as a result of our work product from our group? Then hopes and visions were identified and barriers and gaps. That led to a community vision being formed, and then the well-being collaborative as an organizational way of implementing the vision. And if we go down a little bit further, you'll see a model. It's a petal model. You'll see there's the Buffalo County Wellbeing Collaborative, and there's a steering committee of community members that will help drive and support the work of these 4 other work groups that each are part of the petal. Behavioral health is a work group, access, vulnerable populations, and children and youth. And so there we are, the children and youth work group. That's where we are today, starting. We're the first group to launch. And our work, as you can see, the work of all of us will be focused on the impact. So driving the work of all the groups, if you'll scroll up just a little bit, Michelle, you'll see Winter 22, the impact statements, which are common for each work group. Increase access to information, resources, trainings, programs, and services, and then to prevent people from entering or re-entering the system. So those are the overarching impacts that we're looking for as we focus on the specific needs within our community for children and youth. So the next image that I think Michelle's going to show, and then there we go. So pulling out of the timeline, you'll recognize some of the words that I used just a minute ago. These are the foundation elements that were referenced in the timeline. We showed you how and the order in which they were identified. The collective impact, results-based accountability, the wellness indicators, the community gaps, and the vision. All of these foundation elements are also what we will use as touchstones for decision-making within our work group. If we get stuck, if we can't identify clearly a next step, we'll come back to these pieces as a checklist, as a checkpoint, to see if we can move our work forward with these handrails in a way. So they'll be pivotal into how we do our work. And we'll return to those. So it's kind of a nice cheat sheet that we'll keep in front of us. And then the last, and there's our, oh, there it is again. There's the pedal with the impact statements, just another summary as a reference point there. And then I believe there's one more graphic. Is that the, maybe not? Okay. So that's a lot of information quickly. What questions do you have before Jason picks up and shares more information with us?
Alexandra, I think we wanted to cover the phases as well. So before we move into Jason's part, yes.
Okay. So
Michelle, do you want me to share? Are you sharing? Oh, she's already on it.
that's great. Awesome. Thanks. Okay. So this this graphic, I think we've all been Zoomed to death and overused Zoom and underused Zoom in some cases. So we decided it was important to be intentional in thinking about the use of Zoom, and that as long as we have the option to meet in person, we'd like to have our meeting objectives or our meeting goals drive the best environment in which to obtain them. So you can see that there are phases that we anticipate: learning, sharing, alignment, and within those phases, we anticipate that it will be more effective in terms of the work that needs to be done if some of those are in person and some are Zoom. And this may change and we'll learn as we go, but this is what we're anticipating. And so we wanted to share that with you as well, so that we can focus more on not convenience, but how do we best get the objectives of the work that we have done advanced. What else would be helpful? Thank you.
Alexandra,
Ready for me now?
I was just going to mention one piece before you start, Jason, and I'm not sure that Alexandra covered it, so please excuse me if I repeated her comments, but I think we see we're in that sharing phase, and some of you may just be in that learning phase because you're just kind of stepping in to the Zoom and the orientation. So we are launching orientation meetings to learn more about this process. If you want a little bit more of a deeper dive, just let the staff know and we can set up some orientation time with you. So we feel like we're in that sharing phase right now and moving into that alignment for that in-person piece. So again, I apologize if that's what Alexandra had already mentioned.
You want to put that resource matrix up?
Yes, please hold. Matt, do you have that open? It's that Excel file is not opening for me for some reason.
Yeah, please hold.
I have it up too if you need me to share my screen.
If you haven't ready, Chandra, sorry, you should be able to share if you would like.
On it.
Thank you. Can everybody see it? So basically, we've heard from everybody that's attending these meetings, and we're ready to move to action. We'd also like to hear about access to resources, and we want you guys to know how important that is. We also wanted to speed up the process by inviting you guys to share the resources you offer to the community and the ages you all serve on a survey link before the meeting. This matrix is going to capture what we've collected from your answers on the survey itself. We've added a couple more columns to move our conversations towards action. We want to help get our work to action, so we took the next step in building this working document. We hope you print it off or type into the matrix to help build your mental model of supports for children, youth, and adolescents. Sorry, trying to get mine to come up. So we want to move from the sharing phase to the alignment phase, as you heard from Alexandria earlier. To get to the alignment phase, we're asking you to listen for opportunities where the resources have a shared impact and potential to increase access or capacity to youth, children, and adolescents. There's a column for opportunities for an enhanced access capacity for you to take notes on today. We've also added a column to track questions you have today. Since we have a short amount of time, we'd like you to write down your questions and or answers. We're going to enter into breakouts in a few minutes to give you time to discuss and fill out your matrix. We'll be breaking out in our age groups. Does anybody have any questions about that? Okay, I think Chandra's next.
Okay. I'm going to stop sharing. There we go. Just making sure that everybody has access to their matrix. Does anybody need a minute or two to find that? Kind of priming the brain, priming the pump here. In a minute, we're going to be choosing an age group to get into a Zoom breakout with. And as I was looking at that, the survey answers, some of your agencies span a lifetime. And so as you think about which group to enter, it's totally up to you, but you might want to focus on an age group where you might have the most resources as just a way to leverage the next part of the conversation as we talk about capacity. So I'm scanning the room here. Does anybody need any more time to get their matrix? Okay, All right. So what's going to happen once you've chosen your age group to join that breakout session, that breakout room, each agency in there is going to spend some time. And again, I'm looking at the time. I think we've gained a little bit of time, which is good. And not knowing how many are going to go into each group, you all can do the math. If there are 5 groups, maybe you spend a minute per group, and each group just shares out the answers to the questions that we're going to pose. If you have 15, maybe it's 30 seconds. And so I'll leave that all up to you, but ideally you're going to have your matrix up, and whoever's in the room with you, as they are sharing out, you are filling in your matrix, taking a few notes about what you heard, some ahas. And I think that's kind of how I wanted to prime that. Again, what is the point of the breakout room? And I'm just going to repeat what has been said, is we're looking at capacity, and we really want to know what agencies have the capacity to do more. You're probably not used to hearing that question. Oftentimes it's the other way around of where do you need help or what can't you do, and you need to be able to do. We want to approach it from what is your expertise? Where can you lean in more? Where do you have more capacity to give to the community? The 2 questions, and we'll put this in the breakout room chat, but the 2 questions, the first one again is based on the resources you have provided as you're listening to the groups and you're sharing out, where do you see capacity to enhance services, programs, trainings for children, adolescents, and youth? And are resources inclusive, equitable, and support diversity? Do we address lived experiences as we gain information on our programs, services, and trainings being offered? So those are the 2 undergirding questions that are going to frame our conversations. Okay, any questions about that? We'll take a look at the chat, what's happening there. Oh, thank you, Matt. Based on the time, I think we're going to spend about 30 minutes in our breakout conversations rather than, I think we originally had like 20 or 25. So I think we're ready to go. Matt, are you going to get us, or is it Michelle who's breaking us out?
Yeah, I got you guys. So I will go ahead and open those up. So like Chandra had said, each one is a different age range, and you should be able to enter the one you like. And if you want to join another one, you can exit, come back, and I can get you in another one. So I'll go ahead and open those. How long do you want to be in these, Chandra?
Let me take a quick peek here. We're supposed to be reporting out at 1:30. So maybe around the 25 mark, we kind of give that last call.
Okay, that sounds good.
And I forgot to mention that all the people who were mentioned, all the leaders that were mentioned today, Alexandra, myself, Dulce, Jason, and Brian, if they're all here, we will also join the areas of our expertise.
All right, I will go ahead and get those open. You guys can join. If it doesn't pop up letting you pick one, just give me a shout which one you would like to join and I can get you put in there. But we'll go ahead and get started and I'll bring you guys back in. Oh, okay.
Yeah, hold on. Oh my gosh, thank you, Denise. I love it when people take care of me because I sometimes I'm a hot mess from time to time. We need someone to take notes and also so we need a recorder/reporter. So someone be bold and someone be courageous to be willing to take notes from your group and also share those out.
All right, thank you for that reminder. So I'll open it up and then I'll apologize in advance. I always cut somebody off when I bring you back, but I'll see you guys in 25 minutes and here we go.
Well, I thoroughly enjoyed my group, and so I'm really looking forward to this next part. If the reporter from breakout session 1, which included the 0 to 5, who is that reporter?
That would be me.
Thank you, Libby.
Okay, it was a privilege and a pleasure to bring in this group and to hear about all of the strengths and everything that's happening in Buffalo County. I have always been in awe of all of the opportunities that are offered and provided here. So a shout out again to your community as a whole. So we had a variety of folks on the call from a lot of different agencies. We had YMCA childcare in our group, or the YMCA, and really talked about all of the different activities available within that YMCA framework. Bailey shared out childcare is available for children ages 18 months to 5 years. And then there's also a school age program. They also have a program called Child Watch, which is also available. They offer camps, swimming lessons, different kinds of sports opportunities, music lessons. They do offer financial support for those that may need some help with memberships, and they have an expansion coming with some new opportunities. One that was shared was called the Learning Kitchen, which really sounded intriguing. I want to participate with that. The YMCA is also involved with Rooted in Relationships and the Pyramid Initiative here. So helping to provide the quality universal practices within their childcare and meeting those social emotional needs. And anybody from our group, if there's something that I've missed, please jump in. Angie Johnson reported out next, and she also has childcare here in Buffalo County. Talked really about her strengths as far as participating in the Pyramid and Sixpence. So again, really striving to provide the quality environments in childcare that families are looking for. They've got 105 spots available. 105 spots total available. 65 of those are being used. So they really have the space to take on more kiddos. Looking for some staffing. I'm very proud of the staff that's working there, and again participating in things like the pyramid model to strengthen their skills. And Angie shared with us that they have room to grow within their facilities, so which is fantastic. Jennifer from the Children's Museum. So the museum is designed, and as an early childhood person, I love this. Designed to provide open-ended child-led learning opportunities for all of those that come to the museum. Other agencies also use their space for respite nights. That was an example given. Also, if families have supervised visits, those can happen there in the museum. They have a strong partnership with the community, which allows them to be able to provide one free fun night per month. And Jennifer shared that that's open to anybody. They've had people from out of state attending those.
Libby, can I break in just really quickly here?
Yes.
We're down to about another minute left of your group. Is there a way to sort of capture where certain agencies have more, where they can lean in, where they have more capacity?
And again, I think that the childcare that's available, I think that again, with the Children's Museum, Two Rivers Public Health has a lot to offer out. Sixpence with Erin and Libby for sure. The childcare referral system, Dina Johnson, free support there to help families. I learned that she also provides education to families and how to interview for childcare providers. So you're in short, yes, we definitely have more resources here that can be leveraged.
Did your group get to talk about the second question at all?
Some
I'm-
of, some
Go
of those
ahead.
some of those responses were wrapped into the description of assets and strengths in terms of translating materials into multiple languages and identifying vulnerable families that needs financial assistance to participate in programs. I think another theme is that all of these organizations have great channels of access to communicate with parents.
Okay. Excellent. Thank you, group number 1. Group number 2, who is the reporter?
This is Dulce.
Sorry, ages 6 to 11.
This is Dulce, and I hope I capture everything. If not, anybody from my team is welcome to join in. We had representatives from Tracy from Catholic Health Initiatives and the SAFE program, and it was Dr. Schaffer from a board member from Buffalo County Community Partners. Martha was there with Buffalo County Community Partners, and then from the Children's Museum, we had representation as well. I apologize if I missed anybody. For the first, we didn't, I guess, quite get to the second question, but for the first question, Martha shared that they could maybe provide or look into reaching out more bilingual staff or maybe reach out to more bilingual community members to see if they're willing to do just be the coaching or work with the coaching program to offer those services to the families. We did discuss the need of different languages and how it is not, I guess, a one agency need, but more of a community need. Along with that, when Tracy was sharing about her resources and how she could do the programming and safety education for the families and children, there was that need again that came with the language access and how maybe if looking in any grants or maybe the right person to see if we could expand that for the community, maybe like a language line. We were just thinking, brainstorming in where who would be the right person, which agency would be the right person to reach out to regarding like, is this a city, a city issue, a county issue? Where do we go from there? But I know that Tracy would be able to offer education if we had some, maybe the people to be able to interpret and just reach out more people in the community. I think another resource that I shared through the migrant program, I just expanded on just some of the services that are not being utilized and how they sometimes change just based on what Buffalo County is already doing. For example, the tutoring, that we could provide that tutoring service, but we don't have the staff to be able to do that. But it's something that we have access to through our grant and devices and many more things. I will add more notes in that document shortly after the meeting in regards to how my agency could provide some of those services. I'm limited to providing services to migrant students only, but I know that some of those students are gonna be students that are already working with the other agencies as well. Anything else that I may have missed? The Children's Museum, we share that. I think, for example, the reduced rate, not everybody knows about that being an option, or the family nights and how helpful it could be to be able to share that information with more people in the community. I know that I'm able to reach the families that I work with, but I guess in Buffalo County, there would be a lot of other agencies that would be able to be that bridge or just provide that information, and them as well when groups go in, maybe send that information with the students during tours or during those visits. Anything else that I may have missed? Okay, they think I covered it well, I guess. Yeah.
Yes,
Excellent job. Thank you. Thank you. That was excellent information. Moving on to group 3, 12 to 17-year-olds. And you got 3 minutes.
That was us. Okay, I'll report out fast. So kind of the thought process behind all of our meeting was we shared out about all the programs that the different organizations offer to this population. And a lot of them actually serve like the full spectrum of birth to adults. So we talked a little bit about that, and I will work to fill out this matrix and add that as well. But what we talked a lot about also was kind of access to services, gaps in services, things that we wanted to look at enhancing or kind of making more available in our community. We had the child psychiatrist serving that younger population, so 13 and under. Also counselors, just in general in the community. It was brought up that there's not always a Spanish speaking therapist available for the teenagers that we're working with. Talking a lot about youth and prevention, and those programs being guided by the youth themselves, or parenting programs being guided by parent leaders in the community, and the difference that that makes accessing services and having a peer support you along the way looks different than hearing sometimes that feedback from a just general provider. So the importance of having that peer or youth driven access to programming. Talked about broadening who we're reaching out to. So just making sure that we're being inclusive of the population that we're serving, and ways to do that. So if that means things written or posted in different languages, so everybody can have access to services. We mentioned another area of need is translation services in our communities, having access to interpreters, language lines, things like that. We also talked about what was going well in the community. So there's a shout out to the Hanny Arram Center, and with Josh and his program and Jessica and her programs, and just how important that consistency is for these youth that we serve, when sometimes that's the only person they have is that counselor they're seeing every week, or that community provider that is the consistent figure in their life, and that's just really something that they need. Jessica brought up that they serve 386 youth through her counseling program, which those are really great numbers. And it sounds like they still have capacity to continue to do that great work. We also talked about the HOPE program, which I wasn't aware of this, but it's where youth at Ymca or at Kearney High wear a green bandana, and they're trained to speak about mental health services and how to access help for that, which is a very interesting approach, again, like youth or young adult driven and peer support. And then another positive thing that has come out of just the community is meeting in groups in person, and just having a really supportive community to continue to drive the work forward. So I don't know if I missed anything or if anybody wants to contribute, but a lot of really great conversations, I think.
Hearing no questions or anybody jumping in, thank you, Emily, that was great. Breakout session number 4, 18 plus. Who is the reporter there?
Sure. So this is Abby. We had a great diverse group on our team here. We started out talking about the Brain Injury Alliance and the programs that they offer. Lots of programming and presentations, screening and education for basically anyone impacted by a brain injury. I thought it was impactful that she mentioned, we need to think more than just concussion training and management. We need to look at individuals who have been impacted by medical situations like tumors, aneurysms, strokes, accidents. And it was interesting because we talked about how there's actually, and Denise is going to look into this, but there's possibly a study going on with Lancaster County with their diversion program, and they're seeing that a certain percentage of individuals on diversion actually have some form of a brain injury. And so having just that recognition of awareness, education, they definitely do have the impact of lived experience within this agency, having employees who have experienced this, as well as peer support going on. definitely have maybe some opportunities for written translation. That's been a challenge with the group. We talked about mental health certificates that are allowing individuals to seek mental health therapy if there's possibly no means of financial means. So that's increasing our access. Also, impact of the workforce development.
I was hoping she would pop back in. I'm trying to think who else was in that group. Nicole?
Yeah. I think she is for sure frozen. So yeah, we talked about that, just that lack of financial support and the mental health certificates being available. Thank you, Michelle. She shared a document with me. And then we also talked a little bit about, me and Samantha Keim talked about kiddos that are aging out of foster care and our Bridge to Independence program and eligibility, which Michelle or Matt is going to share with the team. We didn't have the ability to drop it into the actual chat, but there is a Dropbox that Michelle put in the chat, so you can access that. But that kind of goes through the criteria for that program. We kind of talked about a barrier to that is that statute allows 18-year-olds to sign into like a legally binding lease, unless they're state wards, then they can't. And the department can't sign as like a co-signer for a lease and things like that. So it creates that barrier of getting them kids into their own housing, to prepare them for 19 when they're kind of out on their own. And my team specifically works with children that are aging out of foster care. I supervise a permanency team, so I do adoptions, guardianships, and then also them kiddos that are don't have a alternative permanency plan like adoption or guardianship. But some of my kiddos don't have parental rights, and so they just kind of sometimes lack that support. And we try our best to kind of build that support, but a lot of them kids struggle in that realm. And so getting them ready and prepared to kind of be handed off to the Bridge to Independence coordinator that will work with them after they turn 19. One of their, I guess, feedback to us that are working with them kids prior to that is that the thing that they struggle with the most is once they turn 19, if they can't stay in the foster home that they're in, or they don't have appropriate housing at that time, then that sends them into crisis. Not just the independence worker working with them, but also the child themselves, because they don't know where they're going to go. We have kids that wind up in shelter, and we don't obviously know that that's not best for them. So that's a huge gap. But Bridge to Independence is a great program offering support to them kiddos, and they kind of do some case management, but also connect to other resources within the community. I think that was kind of all that we covered. I'm trying to remember. Anybody else in our group? Anything we missed, either Abby or myself? I think that covered it.
I thought it looked like maybe Lynn Cooper was going to say something. Maybe she just accidentally unmuted, which is just fine.
And I think Abby is back in. I don't know how much she might have heard. Abby, are you with us?
She said she had to step away for a moment.
Oh, okay. All right. Excellent. Okay. Well, excellent reports. Thank you to all the reporters, Libby, Dulce, Emily, and Abby. That was really fantastic. And thank you for taking that task on. And thanks for everybody for sharing out. I will pass it on to Dulce.
Okay, so back in. So just to wrap up, or almost wrap up, what did you hear, I guess during the breakouts, the report outs? What is there anything that you think is missing that maybe we just didn't hear? Or maybe is there I don't know, anything that you would like more conversation about?
Dulce, this is Tana Miller. Can you hear me?
Yes, I can.
Okay, good. My internet's not very stable. I would just share that I feel like we didn't have enough time. We could have talked for a full 2 hours. So there's still a lot of resources that we didn't even get to, that I think, you know, if we leave this meeting, maybe continuing to fill that out with our own resources or people that weren't on that spreadsheet would be important. And I know this isn't exactly related to your question, but one of the things I wanted to share was I heard childcare provider Angie Johnson mention that one of the things that she can provide is that conduit to communication. She has access to a lot of families. And so I just thought that was one of the cooler pieces that I heard from our group that was maybe not what we were talking about, but I think is important for everybody here to think about who's got access to the populations that you're serving or you want to serve, because I think they're around this table.
Thank you, Tana, and I agree. Sometimes we want to share certain information and we don't know exactly who to go to, but I always go to Martha. So it's like, Martha, can you help me spread this word? And I feel that Buffalo County Community Partners has a hub of all the participants, not only in this meeting, but just representatives from different agencies that I think it would be a good start, because we do, with that example, we do have access, for example, myself with a lot of Latino families that I could help you spread some of those resources that you have as well.
Alexander Dillon has access to all the child care providers in Kearney, Buffalo County, and probably more.
Thank you. Is there anything else that that you would like to add?
Hey, Dulcie, it's Emily. I will go ahead and put a plug in for our electronic care coordination platform for those of you that aren't partners yet. It's a great opportunity. So on this call, we discuss a lot of resources and some different things that agencies offer, but we don't always talk about how to get connected with those providers. So we have a electronic referral system that also provides all of that data for the work that agencies are doing in their community. We talk about gaps in services and we have reports to support that. So during these larger conversations, we can certainly provide that as well. So sorry, my dogs are fighting. So what we can provide with that is when somebody sends or receives an electronic referral through the platform, that opposite agency. So if you're sending a referral over to a therapist, you get an email back when they open a case with that client. So you have that closed loop communication, you know that they got to that next provider. So we're not left kind of wondering what's going on with that client. And then you have visibility to other organizations that they're working with in the community. So that helps with not duplicating services, making sure that everybody is on the same page with kind of what that client is doing and who they're working with. So I just thought I would share some of that information too.
Thank you. I guess another question that we have or that we were thinking about, is there anything that caught your attention that you want to discuss in the next meeting that is going to help us move forward with our, I guess, goals? One thing that when I was in the breakout session, somebody said a phrase that we're here to divide and conquer. So they had several members from the same agency go to different groups. For me, it was only me. I wish I would have brought some help along. And I feel that within our own agencies, we have different levels of expertise. And I could say, for example, with Liz Fay would be an expert working with families and preschoolers that I think she should be joining these meetings. But I think with your own agencies, you might have maybe another person that might be able to join us and just bring in their own level of expertise to the table, and maybe go deeper into some of those services that we're trying to provide, or maybe even localize some of those barriers that we for sure have as well. Anything along those lines that maybe you want to do next session in July? And I know it was a lot, I guess, a lot of information, and it's a lot of good resources that everybody shared. And I appreciate your the time that you took to be here. And I'm excited about getting to know not only the resources that you shared by you as a person. Everybody's here because they have a passion, about helping, and I appreciate that, and I appreciate you, all of you guys. If there isn't anything else that you want to add, maybe we should move on to the next one. What to expect of the next meeting with Nicole?
So yeah, we'll go ahead and just kind of wrap up. I know we're getting close to 2 o'clock, and like I said, we want to value your time and respect that. I am so glad and excited to hear you all say we need more time to talk about this, because really that's what we want to do at our next meeting, is bring everybody together face to face. We just feel like the conversation is more productive. We thought the breakout sessions would be a good starting point to kind of get the conversation going, but we want to expand on that. So at our next meeting, it will be face to face. We haven't nailed down the location yet, but we will let you know as soon as we have that set in stone. But our next meeting, kind of what you can kind of be thinking about is just discovering additional capacities available to what we can serve as far as children, youth, and adolescents, and also looking at them gaps. So more to come, more time for that discussion as we move forward. Our next meeting is Wednesday, July 27th from 12:30 to 2. So we'll be glad to see you all in person. Thank you.